Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Ever wondered about the mysterious condition known as infective endocarditis? Well, let's unravel the mystery together. Infective endocarditis, in simple terms, is a serious condition that affects the heart's inner lining, typically the heart valves. This isn't a disease that discriminates. It can affect anyone regardless of age or gender. However, it does show a marked preference for those with certain heart conditions, or those who've undergone heart surgery. Imagine your heart as a well-oiled machine, pumping life-giving blood through your veins. Now imagine a tiny but harmful bacteria entering this perfect system, clinging to the heart valves, growing and wreaking havoc. That's infective endocarditis for you, a silent invader that can cause serious damage if left unchecked. But don't worry, it's not all doom and gloom. As with many health issues, knowledge is power. Understanding the causes and symptoms can be crucial to early diagnosis and treatment. So, what causes infective endocarditis, you might wonder? This condition primarily results from bacteria entering the bloodstream and making a home in the heart. But how does that happen? Well, surprisingly, it can occur through everyday activities. Yes, even something as mundane as brushing your teeth can introduce bacteria into your bloodstream. However, it's more common after certain medical procedures, especially ones that involve the heart. Now, it's not a free for all. Not everyone is equally susceptible to this condition. Those with certain heart conditions or artificial heart valves are more prone to infective endocarditis. Their hearts present a more inviting environment for these unwelcome bacterial guests, increasing their risk. So, in essence, infective endocarditis is a complex interplay between bacteria, our daily activities, medical procedures, and individual heart conditions. Knowing the causes aids in understanding how to reduce the risk of this condition. Now let's talk about the symptoms of infective endocarditis. This condition can manifest in a variety of ways, and it's important to know what to look out for. A common symptom is fever, often accompanied by fatigue. This tiredness isn't just your everyday kind, it's an overwhelming sense of weariness that doesn't go away with rest. Joint and muscle pain is another common symptom, and it's often mistaken for general aches and pains. Then there's the unexpected night sweats, leaving you tossing and turning, unable to get a good night's rest. And let's not forget about the heart murmur, a sound that's often described as a whooshing or swishing heard through a stethoscope. The tricky part is that these symptoms can develop slowly, almost imperceptibly, or they can come on suddenly. They can be similar to the flu, leading many to dismiss them as nothing serious. But if these symptoms persist, it's vital to seek medical attention. Recognizing these symptoms could potentially save a life. Let's summarize the main points about infective endocarditis. This is a serious condition where the inner lining of your heart, specifically the heart valves, becomes infected, typically by bacteria. The main causes are usually linked to factors that can introduce bacteria into your bloodstream. These can include poor oral hygiene, invasive medical procedures, or use of unsterile needles. The symptoms of infective endocarditis are often subtle and may develop slowly over time. They can range from flu-like symptoms such as fever and chills, to more severe signs like heart murmurs, shortness of breath, or unexplained weight loss. It's important to remember these symptoms can be easily mistaken for other illnesses, which underlines the importance of regular checkups and communication with your healthcare provider. Early detection and treatment are essential in managing infective endocarditis and preventing serious complications such as heart failure or stroke. The diagnosis typically involves a combination of physical examination, blood tests, and imaging techniques to confirm the presence of bacteria and assess the damage to your heart valves. Treatment usually entails a course of strong antibiotics, and in severe cases, surgery may be required to repair or replace the damaged heart valves. Prevention is always better than cure. Maintaining good oral hygiene is a crucial step, as problems with your teeth or gums can provide a pathway for bacteria to enter your bloodstream. It's also vital to avoid unsterile injections and to ensure that any medical procedures are carried out under hygienic conditions. If you're at high risk, such as having a history of heart conditions or being a regular intravenous drug user, it's important to receive appropriate medical care to monitor your heart health. Remember, knowledge is power. Stay informed about conditions like infective endocarditis to protect your heart health. UMCCC, your ultimate medical consultant connectors.